Hi everybody, today's lecture is going to be focused on the appendicular skeleton. We will look at the main bones within the appendicular skeleton as well as the structures that are associated with um, each of these bones. So let's go ahead and get started. So we have, oh, sorry guys, one second. So what we have is we're starting with clavicle. So the clavicle, which is also your collarbone, has two main structures. The part that is connecting to the acromion process of the scapula, called the acromial end, and the part that is connecting to the sternum, called the sternal end. So if you're looking at this bone, the sternal ends are thicker, more bulky, versus the acromial end is more flat. So that scapula, the view that you have right here, this is basically your shoulder bone. This is the posterior aspect. And if you guys have ever felt the bone poking out on the shoulder bone that is poking out, that's basically this bone right here, which is called the spine of the scapula. The extension that is the sticking out continuation of the spine is called the acromia. So this is the part that basically connects to the acromial end of the clavicle. Now the spine of the scapula breaks down the posterior of the scapula to a superior portion, which is a small, and a much larger inferior portion. Now the inferior portion is referred to as the infraspinous fossa, and the superior portion is referred to as the supraspinous fossa. You also have three main borders. This border right here, which is facing the acromion, is where your humerus is going to be connected, making this side your lateral border. This side is more close to the medial aspect of the body, therefore it's called the medial border. And then you have the border that is sitting on the top called the superior border. This is the anterior view of the scapula. Notice that the spine is in the back. In the anterior view of the scapula, you have a single surface, and this single surface is referred to as the subscapular fossa. There is a white muscle that covers this. You will learn about them in the muscular lecture called subscapularis. Now, again, if you're looking at this picture, this portion is your spine. The continuation of the spine is the acromion. And the part that you see in the anterior view, there's another extension of the bone called the coracoid process. This region right here, which is called glenoid fossa, you can see it also from this view. It's this kind of the oval structure or indentation in the bone. This is basically where your humerus will attach. So if you're looking at your scapula, the humerus, which is the bone of your arm, will be connecting right here. On the superior border right here, you also have a small notch called the scapular notch. Here is a different view of the scapula again. So this would be your lateral border right here. This is the glenoid fossa where your humerus attaches. This portion is your spine, and therefore the ending of that is the acromion, and the extension that is by itself is called the coracoid process. Now looking at our humerus. So humerus is the bone that basically forms your forearm, and this bone has a few structures you need to know. So you have the head of the humerus, and underneath the head, you have this region right here called the anatomical neck. Now notice this anatomical neck is not very pronounced. As you will see when it's compared to femur, for instance, femur has a very pronounced head, which is absent in humerus. So we have a quote unquote second neck, which is right below that region, and so you kind of wrap around the area called the surgical neck. It's not urgical, it's surgical. Now, if I look at the head of the humerus, which is right here, so I'm looking at the superior view of the bone, I will have a kind of a large portion of the bone protruding and the small one protruding, with a gap between these two. Now, these are points of attachment for muscles. The larger one is called the greater tubercle, and the smaller is called lesser tubercle, with the gap between them called intertubercular groove. Again, remember the word inter means between, tubercular implies between the two tubercles. And then groove or sulcus basically is the cavity. So again, if I'm depicting on this picture, notice this is the larger one, this is the smaller one. So this is your lesser tubercle, this is your greater tubercle, and the gap in between them would be the intertubercular groove. Here is a different view of the humerus. Notice again the head right here. So if the head is pointing down on the opposite side of this, you will have these bumps about halfway through the length of the humerus. These are the points of attachment for a triangular muscle that goes right over your shoulder called the deltoid muscle. So because these are the points of attachment for the muscles, they're called deltoid tuberosity. Now, if I look at the distal end of the humerus, which is the section you see right here, you have quite a few structures. This is the point of the bone of humerus or humerus bone that is interacting with both ulna and radius, which are the bones of your forearm. So if I'm looking at this bone, one of the first thing I want you guys to think about is as full humerus, this side, which is if I go all the way to the other side of the bone, this is where your head would be located, or the head will be pointing this direction. So if I come down, the head is always pointing toward the medial aspect of the body because it needs to have a point of attachment. So these little extensions of the bone on the side, because it's toward the side of the head, is called medial epicondyle. And therefore, the one on the opposite side is called the lateral epicondyle. Now, when you look at this end, you also have two separate structures right here. This first one that I kind of consider to be like a half-done bow tie. So look at this shape, look at what I'm tracking. This structure is called the trochlea. And then you have this more rounded structure on the lateral aspect called the capitulum. You also have two small indentations, one on top of the trochlea called the coronoid fossa, and then a small cavity on top of the capitulum called the radial fossa. So understand that a coronoid fossa is a space where a coronoid process will fit in, and a radial fossa is an area where basically the radius, the bone radius, is going to fit in. So kind of get used to that idea. Fossa would be an opening for a possible process to fit into it. If I reverse the bone and look at the other side of the distal end of the humerus, what I will notice is you have these very pronounced indentation, one single one, and that's called the olecranon fossa. Again, understand when we're talking about olecranon fossa, that means there is a process that is going to fit into here. Again, you can see this half bow tie right here. So this is my half bow tie, which is my trochlea. And then right here, it's not very clear in this view, but right here we will have that circular structure we showed earlier, right here, which is your capitulum. Now, if you were in a class setting, you will be required to know the left and right humerus. But again, because we don't have access to that, we are skipping over that phase. Now, here is your bone ulna. Again, ulna is one of the two bones that forms your forearm. An easy way for myself to remember ulna is looking at kind of the U shape that it has at the end of it, or at the proximal end of it. And this is like U stands for ulna. That's how I remember it. Now, what do you have within that U? You have two structures or two processes, one right here and one right here. and then the notch right in between. So let's process this, guys. Olecranon process of ulna fits into the olecranon fossa of the humerus. Coronoid process of the ulna fits into the coronoid fossa of the humerus. And trochlear notch, which is that U shape that you see formed as a result of these processes, trochlear notch runs right on the surface of the trochlea. So basically, when you bring these two bones together, this is basically the surface that allows the two bones to bend and basically allow you to bend your elbow. On the other end, which is the distal end of the ulna, which is the zoom in version here, you have a small process called the styloid process, which is also very similar to the styloid process of the radius, as we'll talk about in just a minute. And the other side is referred to as the head of your ulna. So if you're looking at the picture, here is my head and here is my styloid process. Now here is a radius. How can I tell this is a radius? What I look at is the end of the bone. So the end of the bone on this side, which is again the proximal end of the bone, is a beautiful circle. So this circle, I'll tell my students, a circle has a radius, hence this bone is called radius. Now that circular end of the bone is the head. The area right underneath it would be its neck. And that little bump that you see is the radial tuberosity. Again, to kind of give you an idea, this edge right here, the head of your radius, runs on what we identified as the capitulum. And then eventually, as you bend the elbow, it fits into the radial fossa. On the distal end of the radius, you have this, again, this little bump or extension or process. This is the same thing as we identified in the ulna. So both of these, both in the ulna and the extension on the radius, is referred to as the styloid process. So it's basically this little bump right here, over here. You also have this indentation right here, basically where ulna and radius are fit into each other. And that little indentation is called the ulnar notch. Now looking at the bones of your wrist, these bones as a group is referred to as the carpal. And they are made up of a total of 8 bones. But before I discuss this with you guys, I want you to understand the naming of the metacarpals first, which makes this process a little bit easier. So we have 5 metacarpals associated with each of your fingers. Your thumb would be number 1 or metacarpal number 1, followed by 2, 3, 4, and your pinky's metacarpal would be the 5th metacarpal. So when you look at this, and again, this is kind of, it make it easier. Notice how it says this is metacarpal 1. So we also know that your thumb, which is metacarpal 1, is on the side of your radius. So your radius would be right here, and your ulna would be on this side, which is closest to your pinky. So the acronym that I have underneath, some lovers try positions that they cannot handle, reads the bone as follows: scaphoid, lunate, triquetrum, pisiform. And then you go back and read the distal 4 bones, which is trapezium, trapezoid, capitate, and hamate. So one more time, you go across from the radius side to the ulnar side, and then you go back and read the next 4 bones again from the radius to the ulna. So scaphoid, lunate, triquetrum, pisiform, trapezium, trapezoid, capitate, and hamate. Now, we already talked about metacarpals, but what about the fingers, the bones of your fingers? Again, if you're looking at all the bones associated with the finger, these are called phalanges. All your fingers, with the exception of your thumb, is made up of 3 bones. These bones, regardless of which finger we're talking about, the tip of your fingers are identified as the distal bone. If you have 3 bones, the one in the middle is considered intermediate, and the one closest to your metacarpal, which are your points of attachment, are identified as your proximal bones. Next, we look at them in terms of which finger they're associated with. Again, thumb would be number 1, and your pinky will be number 5. So when we're identifying these, again, what we have is proximal phalanx. Phalanx means a single finger bone. And then identify the digit. So in this case, this is digit number 2 or second digit. If you're naming this bone right here on the tip, this is a distal phalanx, right? It's the tip of your fingers, and it's digit number 3 or third digit. Let's try to say this with me as I go over it. This bone right here is the first bone closest to my metacarpal, making this your proximal phalanx, and this is your 5th digit. So proximal phalanx, 5th digit. Please do note that in case of your thumb, since there's only 2 bones, you either have a distal bone or a proximal bone, distal or proximal. I tell, this is how you guys remember. If you have 2 kids, you won't have a middle kid, right? So if you have 2 kids, you only have the first one and the last one, no middle. Continuing with your lower limbs bone, we start with a bone called the os coxa, or your pelvic bone. This is actually 3 separate bones that are fused together during childhood to form one large bone, but you still can identify the 3 bones as being ilium, pubis, and ischium. Now again, this is not the best depiction of how do you distinguish how you distinguish pubis from the ischium. Well, one way to look at it is that the pubis bone or pubic bone is relatively thin, but the ischium bone, which is in the back, or ischium bone that is in the back, is more bulky. It has a really roughened surface, and again, the bone itself is thicker or more bulky compared to your pubic bone. And I'll show you a different view in a few minutes. Now, when I look at the ilium, one of the first things I want to establish is the anterior and the posterior aspect of the ilium. So this is what I want you guys to imagine. Sorry about that. When you look at the ilium, ilium is not a straight bone that you have the front and back. It actually sits sideways, making this side the anterior aspect and this side the posterior aspect. So bone sits sideways, and if you want to again kind of imagine it, this is where the sacrum connects to the pelvic bone. So on one side of the sacrum, this is where it connects, and then another hip bone will be sitting on this side. So again, this part of the bone right here will come to the front, and this one is sent to the back where your sacrum is. So now that we have found out that this is the anterior, this is the posterior, you notice that there are 4 little, again, a spine or extensions coming off of this ilium bone. Now, how do I name this? We have the front top and front bottom. We have back top and back bottom. And they are, again, associated with ilium, so they're called iliac spine. So we have anterior superior iliac spine, which I kind of, for me to remember the order, I say as is, A-S-I-S, anterior superior iliac spine, making this anterior inferior iliac spine. This right here, your posterior superior iliac spine and then posterior inferior iliac spine. The large surface on the ilium, basically where a lot of muscles, a wide muscle would attach, called the iliac fossa. And right on the top, you have your iliac crest. Now, right here on the ischium side, you have two indentations. You have a larger one and you have a smaller one. So this larger one is called the greater sciatic notch, which logically you would say the smaller one underneath would be the lesser sciatic notch. So let's take a look. Here's a different view. Again, you have the greater sciatic notch and lesser sciatic notch. And the separation of these two structures in this is this little process called the ischial spine. The surface of the ilium that connects to your sacrum, this surface right here, which is basically identify the posterior aspect of the ilium, is called the auricular surface. Now you have a very pronounced circle or dome inside your ischium. This is called the acetabulum, and this is where the head of your femur fits into your pelvic bone. So if somebody has basically a hip replacement surgery, they're replacing the head of the femur that is fitting into this space. You also have an opening inside your os coxa, and this opening is referred to as the obturator foramen. Here's a different view. Again, same structures. You have your acetabulum. The hole underneath it is obturator foramen. You have the greater sciatic notch and the lesser sciatic notch, and separated by the ischial spine, which is another easy way of finding which side is the ischium. So notice again this ischium compared to the pubic bone that we described here. So look at the pubic bone, relatively thin, a relatively smooth surface. And look at the ischium now. Lots of bumps, a lot of grooves, roughened surface, and the bone is pretty thick. So if I ask you what is the name of this bone, you would say ischium. But if I ask you name the structure or this roughened surface on the structure, that's the ischial tuberosity or ischial tuberosity. If I bring the two pelvic bones together, they connect at this region, which is your pubic bone. So this is your pubic bone and this is your pubic bone. They come together. Within part of this pubic bone, we have the superior ramus and the inferior ramus. And another thing I want you guys to notice is that these two pelvic bones, or pubic bones more specifically, are connected using this cartilaginous tissue that has number 1 on it. This tissue, or this fibrocartilaginous tissue, form what we identified as the pubic symphysis. This is basically holding your two pelvic bones together. The surfaces where these cartilages are interacting, or this cartilage interacts with the pubic bone, is called symphysial surface. And as a result of bringing these two pubic bones together, you create a very pronounced arch underneath it called the pubic arch. The reason we're concerned about the pubic arch is because it is one way, or one of the easy way, to distinguish a male versus a female pelvic. So in a female pelvic, the arch is much wider or broader, and in male, it's narrower. We also have something called the pelvic brim, which is basically the opening for the birth canal in case of females. It's again more oval shape compared to if it's look at it for a male, we will see a more circular structure. So this is the way that you want to think about. Again, your pelvic brim for a woman needs to be wider to allow the babies or allow the baby's shoulder to pass through the birth canal, and that basically makes this structure wider. So a lot of times kind of think about, they look at women's hip in terms of seeing if that woman is, and I put that in quote unquote, good for having kids, because again, it's a good sign that a woman have a wide pelvic brim. Please ignore, for our purpose of doing distance ed, identification of right and left coxa. However, the description of how you can do that is can be found in this slide, of course. Now moving on, we're looking at the bones that are forming your legs, starting with the thigh bone called the femur. So femur is one of the is the longest bone in terms of your long bones, and it has the following structures on it. You have the head, you have a little indentation in the head called the fovea. The head is followed by the neck, and neck is connected to two structures. These are again points of attachment for the muscles of the thigh. You have a larger structure, which is visible in these two pictures, called the greater trochanter, and a smaller structure on the side called the lesser trochanter. Here is a femur as a whole. Again, notice that it's a pretty long bone. It's formed your entire thigh bone. You have on the distal end of the bone, so at the area where it comes to the contact with tibia and ulna, well, only tibia, I guess I should say, you have these two surfaces right here called the lateral and medial condyle. Again, how do I identify which one is medial? Notice the head. Head is always pointing medially. So that side is the medial, this side is the lateral. You also have a bump on the side. So this bump on the side will be called as the medial epicondyle, as in a condyle on top of another. The space between your medial and lateral condyles is referred to as intercondylar notch, so that little pronounced gap. If you are familiar with popliteal artery, which is located again right behind your kneecap, this is basically where the popliteal artery runs through in the intercondylar notch. Again, please skip the identification of left and right femur. Moving on, we have the tibia. Tibia is the thicker bone that forms your lower leg. It also has the following structures. The area that forms the knee joint with the help of the femur. You have the medial and lateral condyle. The way you identify medial and lateral condyle is by following the other end or distal end of the bone. At the distal end of the tibia, at the medial aspect, you have these little extension or processes called the medial malleolus. So that's identify the medial aspect of the tibia, making the opposite your lateral or lateral condyle. You also have a small little bump on the surface of the bone, again, for points of attachments in terms of tendons and ligaments, and this is referred to as the tibial tuberosity. If you look at the superior view of the tibia, which is right here, so you're looking at it from the top view, you will see two little extensions or processes again coming off of the bone between the two condyles, so they call intercondylar eminence. At the distal end, other than the medial malleolus, you have this indentation also. This is where ulna fits into, and it's referred to as the ulnar, sorry, not ulna, your fibula fits in, and it's called the fibular notch. Again, ignore the right and left identification for tibia. Next, we have fibula. So here again, it's a relatively long bone, and it has two pronounced ends. One that is more elongated, and you can kind of see the zoom in version here. That is the opposite of medial malleolus of the tibia, and it's called the lateral malleolus. And the opposite end, which is kind of more chunky or thick rather than long, it's the head of the fibula. So the lateral malleolus and the medial malleolus of your tibia are forming those little bumps on the side of your ankle. And this area, by the way, has a lot of ligaments that basically secure just the muscles as well as the tarsals and the metatarsals. So damage to this area can last for a long period of time. And again, it also holds the weight of your body. So if there is any damage to it, considering it is avascular, it also takes a long time to heal. Next structure we have is basically your kneecap called the patella. So all I want you guys to know, even though there is multiple labeling here, is that you have the pointy aspect of the patella, which is the apex, and the more flattened surface, which is your base. For our purpose, I don't expect you guys to know the lateral and medial border or medial and lateral articular facets. Moving all the way to your feet. So your feet, we have again the bones that forms your ankle, which are your tarsals. You have your metatarsals, which are the bones forming the sole of your foot. And then lastly, you have your fingers or your toe bones that are called phalanges. And the way we will label these phalanges are identical to what we have used for the fingers. So first of all, before we go further, let's take a look at your tarsal bones. So here is again, big toe is right here. So that's your first metatarsal, and fifth metatarsal is associated with your pinky. So now that you have, basically this would be the medial aspect, and this is the lateral aspect. And you kind of think about your own feet. Your toes are medial, your pinky is lateral. So the largest bone that we have within our tarsal is the bone called calcaneus. And second largest is talus, which is medial to the calcaneus. Top of, or in relation to the calcaneus, right, superior to that, well, anterior to that, I should say, you have cuboid bone, and anterior to your talus, you have a bone called navicular. Now, the last three bones of the tarsals are medial, intermediate, and lateral cuneiform. Again, look at the name, medial, because it's the closest to the big toe. So it's in the medial aspect of the foot. Intermediate is in the middle. And the last one, which is the innermost, is lateral cuneiform. This is the most common misconception I see. People see it as an inside, quote unquote. Therefore, they identify this one as the medial. But we look at it in terms of your whole body, making this your medial cuneiform and this one your lateral cuneiform. Last, let's look at some of the examples of the phalanges. So right here again, for your big toe, you only have two bones. You have the proximal bone and the distal bone. For all the other toes, including your pinky, you still have three bones, even though it is the smallest bones that we have in our fingers. So we describe the name of the bone by identifying its proximity. So we have three bones again: proximal, intermediate, distal, intermediate, proximal. And if you're only talking about your toe, we only have again proximal and distal, no middle child basically. So in this scenario, let's name it. If we're talking about the first finger bone of the pinky, we call that distal phalanx, associated with your fifth digit. This bone is an intermediate phalanx, associated with 1, 2, 3, your third finger. Let's try to see if you guys can say the name of this bone. So this one right here, you have 1, 2, 3, making this your proximal phalanx, and it is your second digit. So that's about it for our appendicular skeleton, and we'll talk about our muscular system in our next lecture.